2 of Devex's coverage from the Universal Health Coverage Pavilion at the United Nations General Assembly. But in fact, in this case, we're live from Brussels, where I am usually Devex's Brussels correspondent to the European institutions. And as part of this very unique year and this very unique moment, one of the things we're doing today is we're actually going all over the world to bring you this event a series of events on universal health coverage. It's day 2, as I said. Those of you who are familiar with Devex and familiar with UNGO would know that usually we would do this in person. Yesterday, colleagues kicked off, again, a digital version of our coverage. And I got in touch with them just recently. And it's amazing. I just asked Jenny in Manila and Amruta in India to tell me what their highlights were from yesterday. A little bit in our family, my dad always thinks you can only review a movie the day afterwards. So I said to Amruta and Jenny, what stayed in your mind after the conversations you had yesterday? Jenny spoke about health worker safety. And she told me that the statistic that really stuck with her was that 68% of people who answered our poll actually said that funding was the biggest issue for health worker safety. Which perhaps you wouldn't necessarily expect. Certainly something we've seen in Brussels, where we were all applauding health workers at 8 p.m. each night, and that has merged with a conversation here about funding the health system as well. So I think that COVID has certainly helped convey that message. And Amruta's conversation was about partnerships. And I asked her what kind of resonated from her conversation yesterday. And she said it was this idea that partnerships are more important than ever at a time when distance and the tyranny of distance is being felt all over the world, and movement is really restricted. The need to work with really local partners and leverage their expertise is more important than ever. So that's the kind of things that we were talking about yesterday. Today we've got a really interesting program ahead. We've got my colleague Debbie, who will be kicking us off shortly with a conversation on the front lines of COVID and really about the kind of innovations that we're seeing. And we're trying to, I think what we'll try and do in that conversation is find some of the common threads, and hopefully it could be useful for all of our listeners in their work. Then our editor-in-chief, Raj Kumar, will be, we've got an interview with Mark Lowcock, the head of the United Nations Humanitarian Program. And we also will be discussing partnerships with Raj, and there'll be some conversations, including with the Ethiopian health minister. So there's plenty to look forward to there, and we will be asking you to give your input as well on all of the social network channels. And finally, we're ending with my colleague Catherine on the West Coast. Typically, she covers Silicon Valley and things like that. She'll be looking at data, which is really her area of expertise, and what we've learnt there from the COVID response. So, as you would imagine, a relatively COVID-heavy program, but also merging with this ongoing conversation, carrying on from the high-level meeting last year on UHC. So that's what we've got ahead of us. The next order of business is to thank our sponsors who are really essential to this kind of work. So for today, we'd thank SEED, Takeda, World Vision, Plan International, the Japanese Organization for International Cooperation in Family Planning, AstraZeneca, Digital Connected Care Coalition, Transform Health, and also United Global Mental Health, MSD for Mothers, and Smile Train. So we're very grateful for your support, and you'll be hearing from representatives of those organizations throughout the day as well. I'll remind you of how you can reach us and how you can contribute. I know I've been going webinar crazy myself as a reporter of the European institutions, really trying to sometimes take part in the conversation. We want to make that as easy as possible for you. So you can reach us on any of the social media platforms you use, Twitter, LinkedIn. We ask you to use the hashtag UHC Pavilion. And we've also got a website, unga75.devex.com, where you can find all sorts of coverage that we'll be producing throughout the week, and we already have produced an interview with the Secretary General, for instance. And please join us on the Hop-In platform, where you can communicate with other people who are following along, answer some of the polls I already mentioned, submit your questions. We look forward to hearing from you and putting your questions to our guests as well. So with that, I might bring in the formidable Debbie Charles, if she's there, and we can talk about what she's got planned for us.
Formidable is quite a way to start an introduction. Thanks, Vince. It's nice to see you here, and it's sort of fun, as you were saying, to be able to do this virtual UNGA side event from various places, and I happen to be in Washington, D.C., so it's nice to be here, and I'm really looking forward to our event today.
So what kind of things do you think you'll be covering?
So we're talking with frontline healthcare workers, and we know we've got people spread from Malawi to Uganda to Kenya to India, and we'll be talking to them about sort of what is the situation that they're seeing, especially given the pandemic. We'll be talking a lot about COVID and what they're seeing, and sort of what is still needed as we work and the governments work towards universal health coverage.
I'm looking forward to that, because in Brussels, we've been talking a lot about how we're going to rearrange our aid infrastructure to meet the COVID crisis, but there hasn't been a lot of information flowing the other way about what some of the needs are, and it'll be interesting, I think, for me to listen to this, having heard about how the European Commission is planning to rearrange its budget guarantees to be more involved in health diagnostics and things like that. Does that match the needs that people are seeing? I think that'll be a really important part of the conversation.
Exactly, and that's why we wanted to bring. And this is the benefit, I guess, again, of the virtual UNGA. We get to bring people in that we wouldn't normally have a chance to be able to speak at this type of event, on the sidelines of the UN General Assembly. So it'll be really interesting to see if we hear what they have to say on what is it that they would like and what do they need and what would they like, if they could talk to governments now, what would they say? And we're also lucky to have the Vice President of Sierra Leone will be speaking at the top of our panel as well. So we'll, hopefully he'll hear some of these messages sent to others, and we'll get to hear what's going on in his country. So it's a good
that sounds like
variety.
my cue. That sounds like my cue to to mute and disappear, and look forward to following the conversation. Thanks.
Thanks very much. But as we were talking about, there's just, we know that health workers are under a lot of strain as they're working to respond to the COVID-19 pandemic. And I think everyone's seen stories from all over the world about the lack of personal protective equipment and other resources as everyone's working in the strained healthcare system. So, it'll be good to see. I think you're see what it is that we're gonna, what is it that people need and what are they looking for? Vince, I think I get to keep you for at least another minute or two before we officially start. So, I know that you're always in Brussels, sort of seeing what the lawmakers are doing and saying and moving towards. So do you have a question for me to pose to these panelists?
Well, I would say, what can a major donor like the EU contribute at a time like this? But it's interesting. Last week here, we had the State of the Union of the President of the European Commission, and she really made health a priority, and she said we need to get better at a health union, which has traditionally been a competency of member states, and she's really using this as a chance to expand potentially the Commission's the EU institutions' bureaucracy powers over health matters. So it would be interesting to look at the division of labour, I suppose, as well, and do the health systems, has this crisis brought out some potential avenues for reform, I suppose. I'd be interested to hear more about that. I know the European Investment Bank, the Gates Foundation is teaming up on a tool for greater diagnostics in health, and that's a largely private sector driven initiative. So I suppose there'll be scope to explore how governments are working with the private sector as well on this.
Great. Well, I think I will, now that I've got extra questions from you, thank you. I think we'll probably move on forward with our event. And I guess we'll talk at the end about the big, what happened, how it went.
Sounds good. Enjoy.
Yeah. Thanks. So as we were talking about, I think if nothing else, this crisis has highlighted the need for a well-trained, well-supplied health workforce and shown us that we need really strong health systems everywhere in the world. And everybody has the right to have a strong health system in order to meet the challenges of a crisis like the coronavirus pandemic. So over the next 70 minutes, we have a jam-packed program. We're going to hear firsthand from people on the ground and frontline health workers. And we'll go from Sierra Leone to Uganda, from India to Malawi to Kenya to learn more about challenges, innovative solutions, and what practitioners would like to ask world leaders to do as the governments are moving towards this goal of universal health coverage. And I guess the bottom line question that we're going to be looking at is, does this pandemic maybe represent an opportunity to refocus on the importance of health systems? And I think, I'm sure everyone would agree that it does. The question is sort of, how do we go about doing that? So we will be going into that today during this panel. Just a few reminders before we get fully started. You can find all the different events that we're doing here at Devex from this UHC pavilion. This is day 2 again. You can go to unga75.devex.com. And in addition to the events, you can also see the news. And I'm the managing editor for our news team. And you can see the news that our reporters are doing. We've been, going around trying to cover as many events as possible. And so you can see all the different stories that we're writing about, all the events that we're talking about. In fact, we write a lot about the importance of healthcare workers and what sort of challenges they're facing. On social media, you can follow us at Devex and follow the hashtag UNGA75 and the hashtag Health for All. For those of you who are using the Hopin platform, you can submit questions at any point and we'll just kind of take them and I'll fit them into the conversation. There's a chat box on there. So feel free to submit some questions for the panelists. And if you have a specific person you want to direct that to, please note that in the question. Also on the platform, you can find some poll questions that we know we'd love to hear what you think about healthcare workers and preparations. So we'll go into the results on that later on during our panel. So I think with all that, I would now like to thank the sponsors who've made this event possible, and we really couldn't do it without them. So I'd like to thank Seed Global Health, Takeda Pharmaceuticals, World Vision, the Japanese Organization for International Cooperation and Family Planning, and Plan International. Thank you very much to them for helping us get this organized. We're trying to get the word out, and they're all doing some really interesting work in this field, as we'll see from the representatives that are talking today. So without further ado, I would like to pass the virtual floor over to Dr. Vanessa Kerry, who is the CEO and founder of Seed Global Health. She'll kind of set the scene for us and introduce the Vice President of the Republic of Sierra Leone, who we're also honored to have today. So Vanessa, I'll pass it over to you.
Thank you very much. And good day, everyone. Thank you for joining us. As mentioned, I'm Vanessa Kerry, and I'm the CEO of Seed Global Health. At Seed, working closely with governments and the public sector, we seek to catalyze lasting change in the public health systems of our partner countries. We help build complete workforce teams that can help provide quality care and save lives. To improve health and respond to moments like now, we know that you have to start with people. Partner deeply and commit for the long term. So I'm very honored to help introduce our keynote speaker today. We're facing an extraordinary time. COVID has laid bare a collective vulnerability. It's shown us that we are all united in risk, but it's also illustrated how some are far more frequently and profoundly impacted than others. And that's including those most disadvantaged politically, economically, and socially. As we address this unprecedented outbreak and all the other health challenges we are facing today, the pandemics of maternal mortality, HIV, TB, malaria, non-communicable disease, we discover we must confront how these inequities are embedded in health systems and stymie our effort to meet the extraordinary care needs of this moment. For SEED, we appreciate this especially in the too frequent paucity of skilled healthcare workers available to serve on the front lines of tackling COVID-19 and all the other health problems we face today. Yet it's their courage, their compassion, and their skills that are most critically needed to serve at the center of robust, resilient, and responsive health systems, especially in COVID. So even as we lean into this moment of technology and thinking about how do we make remote happen more, we cannot forget that health is a human-centered intervention and that we must be investing in the human forces and workforce and people who serve on the front lines. To address some of these themes, I'm deeply honored to introduce to you His Excellency, the Honorable Vice President, Dr. Mohamed Julde Jolo of the Republic of Sierra Leone. The Honorable Vice President holds a PhD in political science from the University of Bordeaux, France. And before the 2018 elections, in which he was brought into his position, he was the Sahel advisor to the Special Representative of the Secretary General of the UN for West Africa and the Sahel. In that capacity, he co-led the elaboration of the UN strategy on the Sahel and worked closely with the peace and security architecture for ECOWAS. He has spent most of his life promoting good governance and security in West Africa. And in his current capacity, he is keen and committed to serve the people of Sierra Leone and ensure that the country can catalyze sustainable and transformative development. The Honorable Vice President has frequently noted that COVID-19 is an existential time to change how we view and ensure the health of a population and his population. COVID in this moment should challenge us to move beyond just an immediate public health response to limit the number of cases, but to also create robust, well-staffed and well-equipped and stronger health systems that can respond to both the pandemic and the ongoing health needs of populations. The Honorable Vice President and I recently wrote together about how Africa has for too long been imprisoned by a cycle of poverty and poor health. We highlight how COVID-19 will accelerate this cycle unless we vigorously change how we deliver health services on the continent or as we're learning around the globe. We offered that strong leadership from government can enforce new paradigms for longer term, more intensive investment in health system strengthening so that progress can far exceed just surviving COVID-19. With this vision and commitment, success in the aftermath of COVID-19 can be won when every individual has unfettered access to quality, comprehensive, and responsive healthcare, led by a well-equipped and skilled workforce, and individuals have the opportunity to be part of a stronger future for all, economically, socially, and with security. The Honorable Vice President is a champion for changing the narrative of not only his country, Sierra Leone, but I believe the world. His profound commitment to show the impact of the power of health and a more ambitious approach to protecting lives will not only save lives in COVID now, but provide a needed example of what is possible when we invest in people. Ladies and gentlemen, please welcome the Honorable Vice President of the Republic of Sierra Leone.
Thank you very much, Professor Vanessa, for that introduction. Distinguished ladies and gentlemen, it is for me an honor and pleasure to be part of this event, particularly within the context of the 75th session of the United Nations General Assembly. This event is particularly important given the prevailing context as the world is grappling today with the corona pandemic. According to WHO, there are now over 31 million confirmed cases of COVID-19 in the world and about 1 million deaths. Of the 31 million confirmed cases, over 1 million are in Africa. Declared as a global pandemic in March 2020 by the WHO, the COVID-19 outbreak has not only caused a massive strain on health system, but has also significantly impacted the global economy. The World Bank baseline forecast envisioned a 5.2% contraction in global GDP in 2020 alone, which is considered the deepest global recession in decades. Distinguished ladies and gentlemen, the pandemic is already impacting the supply chain for drugs and medical equipment. The most glaring impact in countries like Sierra Leone today is the diversion of resources involving staff, medicines, and equipment to the COVID-19 fight away from other essential health services. A recent research by the Guttmacher Institute estimates that COVID-19 related disruptions can cause about 10% decline in service coverage of essential pregnancy-related and newborn care in 132 low and middle income countries. Equally, a modeling study in 118 middle and low income countries published in The Lancet painted a scenario of over 250,000 additional child deaths and 12,200 additional maternal deaths in just a 6-month period. Distinguished ladies and gentlemen, you will all agree with me that these are worrying numbers, especially for countries like ours, where the health system is already overstretched. A recent analysis done by the Saving Lives program using Sierra Leone data confirm some of these fears. For example, in March and April alone, the number of children who received BCG vaccine in Sierra Leone dropped by 17 to 20% respectively when compared to numbers in March and April of 2019. The sharpest decline was also evident in the area of acute respiratory infection service delivery, up to 33%, and in suspected malaria delivery, 27%, though malaria shows signs and symptoms similar to the case definition of COVID-19. Interestingly, evidence from the Ebola outbreak also showed similar trends, but we are obviously confined to the countries that suffered the outbreak, including Sierra Leone. The most important lesson we learned from the Ebola experience was to act quickly. That is how it is no secret today that the response to Ebola in Sierra Leone was slowed due to many challenges, including governance, leadership, and human resources. Our government learned from those experiences and started preparedness for COVID-19 in January 2020, when most countries with no cases or caseloads were not prioritizing the pandemic at that time. We took 2.5 months to position our healthcare system, our healthcare workers, and our communities for the inevitable first positive case. However, the first COVID-19 case in Sierra Leone was confirmed March 30. Interestingly, however, we also mainstream technology and innovation into our response, particularly with regards to tracking, tracing, and monitoring of quarantine and treatment centers, because we believe that data is vital to successful planning and effective response. Distinguished ladies and gentlemen, all this happened in a context where we already faced immense challenges with regards to insufficient doctors, nurses, and other clinical care staff, a situation further exacerbated by the Ebola outbreak. It is estimated that between 7 to 9% of health workforce were lost due to Ebola. The hiring of over 3,000 healthcare workers in the last quarter of 2019 indicates that we now have more hands on deck than before to tackle COVID-19. The preparedness period enabled us to train and capacitate the healthcare workers to engage with COVID-19, both in terms of prevention, control guidelines, and establishing standard operating procedures. Like other countries, We are facing critical challenges in certain areas such as enforcing compliance, limited PPEs, getting healthcare infrastructure to match up with the tempo of the spread, limited laboratory facilities for testing, and a very limited workforce. In Sierra Leone today, the ratio of doctors, nurses, and midwives per 10,000 people stands at 1.4, while the SDG index threshold is 44.5 doctors, nurses, and midwives per 10,000 people. To cope with COVID-19, we need strong primary healthcare infrastructure to ensure access and enhance quality delivery of services. While Sierra Leone at present has many primary healthcare centers, they remain largely understaffed, with majority of healthcare workers concentrated in urban centers, making health force distribution to where needs are most felt very challenging. Although these are widespread concerns, not only in Sierra Leone, but in a large part of sub-Saharan Africa, the major deficit points that the major deficit in our healthcare delivery system, and thus underline the dear need to invest in our healthcare system. Distinguished ladies and gentlemen, if we want to manage and succeed in the face of any future pandemics or outbreak like Ebola, we need to strengthen our healthcare systems within the framework of health for all. It is only when we have robust healthcare system, then we can tackle pandemics in a sustained manner. One of the things we are doing in Sierra Leone today is the establishment of the Sierra Leone Social Health Insurance Scheme to improve financial accessibility to healthcare. This will be based on finances from contributions of the formal sector, earmarked taxes to help us subsidize the cost of universal health coverage. In ensuring that Sierra Leone has a viable and robust healthcare system, including the human and material resources to tackle any health threat, we need to invest in strengthening healthcare delivery. This is no doubt the single most important lesson from our experiences dealing with Ebola in the past and now COVID-19. It is in that direction that we are currently elaborating a strategic plan to capture the transition dynamics from response to resilience. How do we build a bridge between COVID response and investment in healthcare? And I believe, and you will all agree with me, today, this pandemic represents real opportunity, or I will say a glaring opportunity to focus our attention on the future of strong healthcare systems. Today, we are trying as best as possible with our very limited means to position ourselves to respond to COVID-19 in an integrated manner, a response that is rooted concretely in our efforts to look into the future. It is in that spirit that I want to take this opportunity to call on leaders from developing countries like mine, participating in the 75th United Nations General Assembly session, to come together and join the call for action. Together, let us define and set the agenda for health for all. We need to ensure that development partners support government priorities and coordinate among themselves to enhance and leverage each other's investment. We need to define an approach that is built on mutual respect, trust, and accountability on both sides. We need a dialogue with development partners on the nature of support to building resilient healthcare systems, how we could possibly factor the future of healthcare delivery in light of the current realities. Distinguished ladies and gentlemen, this calls for a flexible and dynamic approach that makes room for investment in COVID-19 response in a way that helps us build robust, well-staffed, well-equipped healthcare system, strong enough to respond to both the pandemic and the day-to-day health needs of our people. I am convinced, and I know most of you are convinced, that a paradigm shift to how we deliver healthcare to our people is possible. This is the time, and let's rise up to that challenge. The challenge to deliver accessible and comprehensive healthcare to millions of our people that look up to us. Distinguished ladies and gentlemen, it is in this futuristic spirit that I now declare the event open and look forward to fruitful deliberations. I thank you very much.
Thank you very much, Mr. Vice President. And thank you also, Vanessa, for those words. That was a very strong message from the Vice President of Sierra Leone, which launches us very well into our discussion. We're going to start with a chat with two health practitioners from Uganda. We will have, I'd like to join, we'll have Samson Udo and Alice Atai. Samson is a midwife and lecturer of midwifery and health at Lira University. And Alice is a nursing officer in Uganda, up in the northern section of Uganda. So if they could join me, are you both here? One of the...
Yes, Deborah. Yes.
Hello, Samson. Nice to see
Hello,
you.
Deb. Nice to see you too. Good morning, good afternoon, good evening.
Good afternoon and good evening. And Alice, hello to you. What I would like to start, Alice, I think you're working in the pediatric ward, if I understand correctly, but are also trained in infection prevention. Could you give us a little bit, tell us a little more about your experiences currently as a nurse in Uganda during this pandemic?
Thank you very much. Good afternoon, everyone. Ladies and gentlemen, I am very happy to be for this meeting today. I have served as a nurse for close to 19 years, and all these years I have been attached to children, and I have seen a lot of what has happened in my hospital in Uganda. Earlier on at the beginning, we had to pull children from their parents because of the interest to get local medicine more than the hospital medicine. We had pulled that with the health system strengthening programs that are existing, and our systems had started improving very well. Unfortunately, with this current surge of COVID-19, that has slowed down our services in our area. A lot has happened. We had pulled children out from malnutrition. We have pulled children out from other various preventable diseases. Immunizations had improved, and care for children had improved so greatly, with a lot of programs, refreshment courses, building capacity of health workers, with support from partners, community dialogues. All those have helped support, improve, and strengthen the health system always these years.
And is that continuing now, or what are you seeing that maybe is different with COVID-19? Are you seeing some backtracking in some of that progress?
Thank you very much, distinguished ladies and gentlemen. Within these 6 months of the pandemic, we are seeing a backdrop especially when we look at the statistics of immunization. We are seeing a drop in PCV3. We are seeing a drop in measles vaccine. And compared to April, June, we had a drop of up to 60.8%. This is a drop from 70 at the beginning of the year, around March. So we are seeing there's a challenge. And also malnutrition. We had been having dialogues with mothers, counseling mothers on infant and young child feeding programs, and we had gone up to 85%, but we have dropped down to 60. So this brings a lot of fear, and we don't know what will happen if more pandemics are to come, or even this pandemic is still continuing with us. So we need to build up the health systems together and strengthen health workers, strengthen community health workers to continue and encouraging the community members to embrace the health system and continue attending health programs. The COVID-19 should not make them lose hope. Yes.
Thank you very much, Alice. There's very well said, and they're pretty harsh numbers when you look at what's happened there. I'd like to turn to Samson. You are a midwife. So I'd like to know, I mean, given we have been reporting at Devex that maybe a lot of pregnant women aren't getting the care they need, they're afraid to go get care and to go to the medical practitioners because of COVID. What are you seeing as a midwife? Are you able to continue to deliver care to mothers at this point during this time? And what sorts of challenges are you facing? If you could turn your mute off.
Oh, thank you.
Happens to everyone.
Yes, thank you very much. Sorry for that hiccup. I was saying it has been a sort of a roller coaster for us since the first case was confirmed in March. So with the first case in March, there was a bit of a scare from the general population and even across the hospitals. And suddenly we started seeing the number of mothers coming for maternity services actually reducing. And in about 2-3 months, we felt as if we were making progress in terms of controlling the pandemic. But suddenly we are beginning to see a flaring of the cases. This looks like almost our first peak of COVID. And again, now we are seeing the number of mothers coming to our facilities beginning to drop all of a sudden. And speaking contextually from my hospital, it was like a safe haven for mothers because we had no case of COVID at all. But now we have not only one, not only two, and patients are scared. They don't want to come. And true, I agree with you. COVID is having a devastating effect on the access to maternity care for our mothers.
So what is a good suggestion on how to fix that? Is it more of an education issue to the public to let them know that it's safe, or how do you think is the best way to kind of solve this kind of issue and make sure people are getting the care they need?
Well, I think it's about really strengthening the kind of services that our mothers are receiving and the newborns. First of all, when they come to the facility, they see the setup that is there. Does the setup restore confidence? Does the setup guarantee safety? And these are people who can reason for themselves. And yes, they can go back with a made-up mind, saying, I will come back to this facility, or I will not come back to this facility. And so I think that part of the solution of addressing that is, first of all, making sure that the healthcare workers present themselves in a manner that restores confidence to the patients. Do I have the necessary PPEs that I have? When my client comes, do they see that I am, first of all, protected, and so I can also protect them? And once we can address that, then we can take our focus a little further now to the patients who are coming And I think we can be able to find a good balance with this pandemic here.
Thank you. That's a good point. Alice, are you seeing a problem if acquiring the needed supplies of personal protective equipment, especially if that is going to help bring about some confidence in the medical system? Are you getting what you need?
Thank you very much. There's still a very big challenge with acquiring the PPEs as needed. At one time, you find there are no masks because we have to keep on disposing them every now and then. The healthcare workers are quite many, and most times they are not enough for the healthcare workers.
And then that does have the, as Samson was saying, that if there's, you want to make sure you can protect your healthcare workers, not just, I mean, for their health, which is very important in keeping the quantity of healthcare workers that we have, but also to show, to bring confidence to the patients so that they know that they can be safe when they come in to see you. Well, I'd like to ask each of you, what sort of support would you like to see from donors and the global health community, and you know, what would you ask them for?
Thank you very much. Thank you very much. Yes, I would like to see a lot of support, especially for maternal child health, because when I look at what is happening now, I see they are the most disadvantaged, the mothers and the children. And also the current problem that we have about the teenage girls, because of no school, they are at home, they are getting pregnant. How can we help them have safe delivery? How can we help them bring up these children well? How can we make them have hope that there is still tomorrow for them to go back to school? So we need a lot of support in maternal child health care, and see if we can improve on that and strengthen that.
That's very true. Samson, what are your thoughts? What would you like to see?
Yes, I think from an individual level and as a healthcare worker, I think that COVID-19 has reawakened us to realize that healthcare workers have been ignored for a long time. The frontline workers, I would say the gatekeepers of this health that all of us badly want. And if there's any one thing I would ask for, I think that we need to really invest in the health workforce. We need to make sure that these people's well-being is put at the forefront. Because we make a pledge to serve these people, we know if we are catered for, definitely we have an obligation to care for our patients, regardless of whether it's a pandemic or wherever it is, we know it's our responsibility. And if our well-being is taken care of, sure, any day we shall appear to serve the people.
Yeah, it seems like a fair request to make to make sure that your governments and donors and everyone are offering the ability for you to be able to take care of yourselves so that you can take care of others. Yes. I feel like I could talk to both of you for ages, but unfortunately we have to move on to the other panel. But these are really interesting insights that we're seeing, and we may be back to you with some questions at some point later in the panel. But thank you so much for giving us your views on what's going on in Uganda and what you need. And I think they're all very valid concerns. And thank you for all the work that you're doing.
Yeah, thank you, Deborah. Thank you.
I think we're going to continue on that same exact sort of theme. I think we'll hear similar comments from other health practitioners, but we're going to open up for our next panel. We have Luis Kadama, who is the chief of OBGYN department at the Malawi College of Medicine. And we have Jill Adhiambo Matakwa. She's the Kennedy, sorry, talking too fast. She's the Kenya country manager for the Japanese Organization for International Cooperation and Family Planning. And we have Owungshi Mayomi Zimik, who's the Community Health Coordinator at the Sagar Health Project with World Vision India. And just so you don't think I'm crazy, I am calling Zimik when I talk to him because he says that he prefers that name. And so that's why hopefully you'll understand who I'm talking to. So welcome all three of you. Thank you for joining me. Let's just continue that conversation that we were hearing from our great practitioners in Uganda. I guess, Luis, COVID-19 has highlighted some of the challenges that healthcare staff were already facing. Can you talk about what challenges the pandemic maybe brought to light, and how is there any positive upside on the fact that now people are aware of these issues?
Yeah, no, thanks, Deb. I think coming in of COVID-19, the pandemic for example, in our country, it really exposed how our health system, how fragile it is. You remember the Right Honorable Vice President did indicate that we had, in most of the countries, we had to divert some of the resources. And we have a shortage of health workers around, and also the system can't really cope. So what it has shown actually is that there should be an investment in the public health system in looking after all the healthcare cadres, and also in making sure that the public health system is sustainable on its own. So that's what I would say for now, to say this has been the exposure, and I think it's an opportunity later on that we'll talk through in terms of how best we can invest in this opportunity we have upfront. Thanks, Deb.
Thank you. Jill, what do you think? What sort of challenges do you think the pandemic brought to light that maybe it's good that we're talking about them?
Okay, thank you. From my end, I happen to work both at facility level and community level. So the challenges that we're already facing in Kenya of understaffing, commodity stockout, lack of equipment at facility level, and at the community level, we have not sufficient community health workers to empower the community and offer community literacy. So during this pandemic, this actually worsened, of course, because as much as we have health facility system that is strong, a pandemic will cause an influx, of course, in patients who are coming into these facilities. So we quickly had to recruit more staff on short-term basis in these facilities. We had to quickly look at equipment and of course procure commodities, especially PPEs, just to be ready for the influx of these patients. But we also realized that community health volunteers have a great role in preventing or disseminating messages to the community so that we try and contain and also prevent the infection from spreading. So for the community health volunteers, we worked with them very well, but the challenge of having PPEs, protecting themselves as they go to the communities and teach the communities on hand washing, on using masks and all that, we also had to prevent the community health volunteers, and lack of PPEs was a major challenge to these volunteers as they were containing. But luckily in Kenya, we have managed to contain, and the curve is slowly going down thanks to the preventive measures that were put in place with the community health volunteers. So both at community level and facility level, we still have some work to do. And we now know that we need to be prepared.
Yeah, I think it's always learning the hard way of who needs the preparation. Maybe things you don't think of ahead of time are coming to light, and maybe that's how we progress in the future. What about you, Zimik, in India? You're in rural India. Maybe you can give us your view.
Yeah, in India, we are facing so many challenges regarding our community that people are totally, doesn't want to react to doesn't want to follow to the government instruction given by the authorities. And we have so many challenges like that. The pregnant women and the children doesn't want to attend to the vaccination day because the family is afraid of getting coronavirus from the session that all the village women would come together in one place. So they are afraid of that. And I will just point out some important things that is going on in India. And in fact, thank you so much for this opportunity to share what is happening in India during these difficult times. So first of all, for the common population, for the major population, like, in India, like such type of rural communities, most of the people are laborer. So since they have lost their job, there is no way to earn a living. But, like instead of, doing some kind of crime things, they borrow money, they borrow food from the neighbor, they borrow money from the rich people. And now again, the tension is also increasing that they have borrowed or they become the born laborer. So such type of problems are also increasing. And talking about the challenges that the families usually have is that since the nationwide lockdown and this COVID pandemic have started, the rate of pregnancy is also increasing in every villages. So an availability of services and the lack of accessing to the health services and the family planning methods, the rate of pregnancy is also increasing, and the use of family planning methods are decreasing. And India with a huge population, if I talk about the people, most of the people in every villages. Now in my locality, in this project, I have 131 villages. And in every villages, around 500 people have reverse migrated from the town where they went to work. Now these people are coming back and they do not have any kind of agricultural land for cultivation, and they do not have the business to start for their living to support the families. So the thing is, like some of the crime, like robbery, is also happening in the area also. But still, government has taken so many steps on it. Although this this wearing face masks and then staying at home and then having the habits of hand washing frequently. Although all these things are very new to our culture, we are, we are slowly we are coming back to that, to adopt that new normal life. And so the government has also taken at the community level, like World Vision India with the health department is also creating so many awareness program and then sensitizing the community. So we are moving on like that with so many difficulties. Thanks so much.
Thank you. No, so it sounds like wellness programs and sort of the whole just getting people aware of what's happening is really important. I guess, is that something that needs to be, the government need to work on making sure there's more funding for that? Are you getting a sense that there's enough of funding, or either the government or various organizations?
Yeah, thank you so much for that question. Yeah, definitely, like we call as the COVID-19 response, that we do a survey in the field, in the community, and from that survey, we select some of the POP's families, poorest of the poor families, and we select the malnourished families. We select the pregnant women with low BMI. We have assessed, and those who doesn't have the food security, immediate food security. So we have that in the area, and Now, not only in my project, but all over India, we are selecting, we are doing survey, and we have assessed the food basket to everyone through World Vision. So the point is, if we have more such type of funds, with all this program, the money is involved. So if we have that fund, if we have that more fund from the government or from the donations, we would have more opportunity to create such type of community sensitization, and in terms of bringing awareness to the people and reaching out the helping hand to the community people, so that they may, at least they may have something to stand by.
Yeah, thank you. Luis or Jill, do either of you want to comment on that before I move on to my next question?
No, I don't have. I think I'm happy with the responses so far. I'm looking forward to the next set of questions coming.
Okay, how about, so Luis, why don't I ask you more specifically on what do you need as frontline workers to be prepared for the next pandemic? Not just looking at how to handle this one, but sort of looking ahead. What do you see the governments need to do to help you get there?
Thanks, Deb. I think one of the things that I would want really the leadership to think about is, have we had pandemics before? We have had Ebola, we have had Zika, and these have already exposed how fragile our health system is. And we've had poor outcomes that have come through from there. Now with COVID-19, the interesting thing is the lockdown strategy that came through. So it meant that if you need specialized care, you have to be flown outside the country. And with the closure of the aviation industry, it means that actually you have to stay in the country. The other thing is that there is a disconnect or inequity between the public and the private sector. Previously, you'd get a better service in the private sector if you are able to pay for it. But COVID-19 really showed how it is important to invest in the public health system, because one, the private sector could not accept confirmed COVID cases in their units. The other thing is, if you were critically sick or you needed intensive care unit in the private sector with COVID, they could not accept you. So what I'm looking at is, let's learn from this pandemic, and then we need a huge investment in the public health system. Remember, one of the goals is to have a quality responsive system. This is what I'm looking forward for, to say this is an opportunity for us to push for at least a system which is responsive, which is accessible by everyone. In Malawi, the public health system really showed how fragile it is, but also we managed to save so many lives within the environment we are in. And the government really has acknowledged the workforce, the frontliners, but I think there's more to infrastructure, to the system itself, and to the political commitment. So this is what I'm looking really forward to say. Let's learn from this pandemic if we haven't learned from the previous pandemics. Thanks, Kerry.
Yes. With each pandemic, we hope we learn a little bit more for the next pandemic. As we heard from the Vice President, the teachings, what the country can learn from Ebola has helped in their response now, and hopefully this will help in future responses. Jill, I don't know if you have more to add on that, or if you want to just jump to my next question, which is how important are, and it kind of goes with this, how important are conversations on universal health coverage, which is, now it's been a year since the declaration at the UN General Assembly last year, that there would be work for, universal health coverage for all. So are those important, or what needs to change in the conversations about universal health coverage based on what you're seeing, your local experience? Sorry, Jill,
Sorry. Conversations on universal healthcare coverage are very, very important, and at global level, because as we all know, access to health is a human right. Yeah. So as we talk about it globally, we are able to move together and have like standardized way of achieving universal healthcare globally as opposed to just nationally. As we speak in Kenya, we've piloted the universal healthcare program in 4 counties. It's just ended, and we are now planning to register the whole nation and venture into nationwide UHC. But unfortunately, only 69% of Kenyans know what universal health coverage is. So we still need to work with community health volunteers at community level to educate the community on what universal health coverage is, what it means to them, and the benefits, and all this. So I think globally, I would want more conversations around community health strategies that have worked in other countries and how they can be adopted to countries which we are still struggling or somewhere in between, so that as we ensure that facility level quality is okay, the community also is aware that they can access these services, and the services are of quality, and these services are free. Thank you.
It's a lot of there's a lot of progress, but still so much more that needs to be done, I guess, right?
Yeah.
Thank you. Zimik, what about the issue we've written at Devex about the issue of brain drain, and and just the difficulty of getting the trained medical staff out into especially rural areas like where you are. What do you see the impact of that, and what do you see as a solution for that, what you're seeing on the ground?
Yeah, that question is very right for me, in fact. And thank you so much for that question. Now, the people in India, like I said, most of the things are new to us, as this pandemic is very new to the world. We are, for us also, it is very new. Let me give you one example that now, like I'm the person who goes to door for survey, for monitoring this and that with the government stakeholder. So one incident that I have experienced is that one day we go from one door to another door, and then suddenly one door, I knock at the door, and then one man come out, and he shouted at us that, why are you coming here? You are getting the virus to give us. So this and that, these things are happening in the communities. So sometimes it is very difficult to operate in the community level because the people, let me put this way, that the people are still unaware of the virus. So it is a bit difficult for us to operate all that things. But as we are moving on through this pandemic, we have to adopt a new, the new fundamental principle of new normal now. That we have to, the field workers, the frontline workers must have the capacity to identify the cases at the earliest, and to protect the transmission from one person to another person. Like we must understand, and we must maintain the social distances. We should have all that kind of principle of the new normal daily life. So this is very much important. And the difficult thing is that as a public health worker, we can understand the things, but the people should also have to understand this thing, that he need to stay at home. If there is no work, he should not go out of the house, and then like all sorts of things. that people also should have to understand that. So from Indian perspective, if I speak about the sensitization in community and bringing awareness is very, very important at this moment. This is the need. This is the need of the hour. So Indian government has also taken so many steps, and so many the government is also empowering the services, not only to doctors and nurses, but also the government is empowering field workers like us, like ASHA workers, like A&M, like Anganwadi worker. All these are in India. All these are the service provision sites based in the village. So the thing is, and if I talk about India, the main India is the rural communities. Let's forget about Delhi or Mumbai. The most population are residing in India. The most population are residing in villages, and these villages are the to communicate to this type of people in these rural communities are very difficult. So because of such reason, we are facing so many problems. But I can hear our Prime Minister, Mr. Modi, also that he is inspiring, he is instructing the people to stay protected from this virus. So we are moving on in this way.
Thank you. Yeah, there are interesting, we're all learning different things, I guess, during this. So we have a poll that's going on while we're having this conversation. So Luis, let me just give you the results and see what you think. It says, one is, what are the biggest challenges facing healthcare workers today? And by far and away, the answers are that the underfunded and underprepared health systems is the biggest challenge. And the second was lack of resources such as PPE. And third was lack of training and capacity. Would you agree with the underfunded and underprepared health systems are sort of the biggest challenge facing healthcare workers today?
Deb, I think I agree with the poll results. I think there are implications in that if these systems are underfunded, we can't win the trust from the community. So for the community to trust us, I think we need to have a robust, functional system. Then people can be coming to us. I can tell you, it might be applying in most of the settings that actually with this COVID-19 pandemic, we have had a few people coming to seek a health service to us. Why? It's because they fear that when they come to us, we'll test them, we'll find them with COVID, that's the end of it. But if they knew that actually we have a good system in place and we've got good health work numbers of healthcare workers in all the cadres, a functional, well-resourced setting, we could be winning the trust and everyone will be rushing to us. So I totally agree with the poll so far. Thanks.
Yeah, it is an interesting element. Thank you for me throwing these numbers right at you. Jill, we have a video question that was submitted for you. If our producers could put that video question up for us and you can hear it.
Thank you to all the speakers for your dedication. My question is directed at Jill. I'm Frank Takeda and the president of the International Confederation of Midwives, an organization that unites more than 1 million midwives in 124 countries globally, including the countries that the panelists come from. Now, as midwives, we strive for equal access to quality maternity care for all, and there is strong evidence to support the key role midwives play in providing this care. Now, COVID-19 does not stop women from becoming pregnant, and now more than ever is the time to invest in a healthy future generation. But we've seen midwives' work being sidelined during the pandemic. Midwives have worked under inhumane circumstances, for example, without PPE. So moving forward, how do you think we can best ensure that midwives are supported to do their essential work of upholding the sexual reproductive health and rights of all women? Thank you.
Thank you for that question. I agree with you that midwives play a very important role in reproductive health and access for women. So lack of PPEs has been a major challenge during the COVID-19 pandemic, and it has affected even the facilities that we are working in. And as you have rightfully said, women are still getting pregnant even in the pandemic. During this pandemic, when it kicked off in Kenya around April, we had women fearing to go to hospitals because the message was stay at home, yeah? So women would not go to deliver in the hospitals due to fear. But when we started working with the community health workers to go back to them and educate them on the importance of delivering in the hospitals, we were able to achieve this. Now, when they go to the facility, again, we have these midwives who don't have PPEs. And as the polling is showing us, funding, it all goes back to funding, both domestic funding, like locally in Kenya, if we could divert funds or allocate funds to procuring of these PPEs or to ensuring our health staff are well protected. So we had a big challenge to an extent that some of the facilities were even closed down because healthcare workers were infected with COVID-19. So investing, I think funding towards protecting the healthcare staff, both domestically, globally, or whoever can support this cause. Even right now, as we are speaking, some facilities are still closed down, and this impedes on women to access the services. And more than 50 healthcare workers that I've worked with contacted this COVID-19 disease due to lack of proper PPEs. So I guess my rallying call will be let's continue resource mobilizing and funding to protect our healthcare workers as they are the forefront. Even as we go to the facilities, if we don't have these healthcare workers there, then we are talking about universal healthcare that is not actually there.
I feel like I can ask you all questions so much because you're giving, this is such an interesting conversation. I think I can fit in one question before I then go around and ask you all for a quick call to action. But one last quick question that goes along with this is, with COVID-19 putting people out of work and deepening poverty in already poor communities, do frontline healthcare workers need to think about new partnerships that not only maintain essential health services, but also address poverty? Just wondering if someone wants to answer that one.
Yeah, I think that it's true. I think really we need to reflect in terms of what the impact of COVID-19 has had on the services, on the health services. So I'm a maternal health specialist, and most of the things I'm looking at the pregnant moms, the newborns, and also as we go to the under fives, that actually poverty has an impact on the performance, also on the economy. So we should be changing our goals and trying as much as possible to see. And I'm also hoping that the partners we have, they can see this as an opportunity to change their lines as well of support, to see how much they can invest as well in improving the literacy, the poverty lines in our settings, mostly in the low middle income countries. So this is an opportunity that we have upfront for us to take up. Thanks, Jeff.
Thank you. I feel like this pandemic has shown us more than ever that everything is really interconnected. And in order to improve something, you need to work on all the other little elements of it. Okay, so now I do a round robin to end our panel. And just quickly, I would say 30 seconds if you can, what call to action would you each give global health leaders that are listening to this conversation today? Why should they invest in the healthcare workforce? Just in simple, if you had 30 seconds to explain it to them. I'll start with you, Zimik.
Thank you so much once again. That question is very, very important for India. Like, let me, to be precise, let me put this way that living in a healthy life is each and everyone's rights. But because of this COVID-19 pandemic, millions and millions of people have died. In the field, I have seen that innocent people, innocent families have died. So my urgent call to action is to invest on strengthening the health system, not only to doctors and nurses, but also the field workers. From Indian perspective, if I speak about the geography where I work, I would really want to see all my field workers, like Anganwadi workers, like Asha workers, like A&M. I would really want to see the day that they have capable to deal with such type of life-threatening diseases among mother, children, and the other population. That is my dream. Now, I will also mention to that as you all know, that World Vision is there in the ground, bringing hope to the hopeless people, and driven by the Christian faith. We believe that every child is the gift of God. Every child is the gift of God. So saving them from such unnatural death is the urgent call to action that I would like to urge to every nation's government, especially to Indian government, and to all the citizens of this global village to come together to fight for this virus, to keep this virus out of humanity, so that we can live in without any fear, so that we can live. Everyone will live in healthy life. So this is the message I want to give the global leader. Thank you. Thanks so much.
Thank you very much. That was very well said. Jill, what do you say?
I think from me, having gone through last year's asks from the UN General Assembly, one of the asks was upholding quality of care. And without investing in healthcare workers, both at facility level and at community level, we may not achieve this, because without motivated, trained, protected healthcare workers, then the quality of services in our facilities will be compromised. So let's not get tired of investing. Let's continue investing in our healthcare workers so as to promote quality services, both at facility level and community level. Thank you.
Thank you very much. Very well said also. Luis, I'll give you the last word here.
Yeah, and I think as a frontliner, I believe we've all been trained to provide a quality responsive service to our patients. But then what I need from the global leaders is to say, let's walk the talk. Can we invest in the public health system? And once there is that investment, it will be very much easier for us really to achieve, to offer this universal health coverage. That's what I would say. Thanks, Dave.
Very well said. Thank you. And I think that sums up so well all of your comments just are a good synthesis of what we've talked about today. I'd now like to thank all of you for joining. I thank you, Zimik, Jill, and Luis for joining this panel. We now have a video with some final thoughts from Takako, again, I'm reading wrong. Takako Ohyabu, who's the Chief Global Corporate Affairs Officer of Takeda Pharmaceuticals. If the producers can put that video up.
Thank you for the opportunity. I'm honored to share the stage with such incredible health workers. Your expertise, energy, and collaboration are guiding lights as we work to address the healthcare challenges of today and tomorrow. My message to our esteemed speakers and audience is this: the private sector is listening. We hear your concerns and appreciate that realities on the ground are nuanced. We recognize your insights and creative solutions, and we stand alongside you as supportive global citizens. A big part of our achieving our ambitions relies on our ability to create a sustainable future. At Takeda, we recognize that we have a responsibility to our patients, our people, and our planet. We're committed to delivering better health for people and a brighter future for the world through the Sustainable Development Goals. I know that our peers across industry share this same perspective. That's why I'm calling on our peers, as well as other leaders worldwide, to support the ideas and solutions discussed today with long-term investments and partnership. Takeda's global CSR program has been partnering with world-class organizations, including our 4 co-presenters, to train health workers, strengthen health systems, and improve access to care for more than a decade. While these priorities do not always deliver the fanfare of immediate headlines, we know they are transforming communities and saving lives. And that's what matters. Thank you again for the opportunity to join the conversation today and to all who made time to participate. Let's continue with the dialogue and, most importantly, partner as we strive to make the world a healthier place for all. Thank you.
That was a perfect fitting end to our amazing conversation. I just wish we had another hour or two to talk. I feel like I have questions for Samson and Alice still, and Jill, Luis, and Zimek. I'm sure I have a million more for you. But I would like to thank Dr. Kerry. I'd like to thank Mr. Vice President, all of our amazing panelists for your really interesting insights today. I think basically we're seeing that this is a chance to make a change, and it feels like there's general consensus that investments in the health system are really what's needed, and governments need to walk the talk, as Luis very appropriately said. So one final thank you to all of our sponsors today, which were Seed Global Health, Takeda, World Vision, Plant International, and JOI-CFP. Thank you very much, and thank you for joining us today in this panel. I see Vince, but I see him on mute.
And now I'm off mute, I think.
Hi there. We all do it.
every Monday news meeting, we all do it. Thank you for animating that conversation. It was great to watch that. You mentioned that you've got lots of follow-up questions. So, and our panelists, as they're logging off, I guess that the baton is passed on to your team of journalists. So I guess I'm wondering if you were chairing a news meeting after that call, what stories would you assign to our global health supremos like Jenny in Manila and others?
I think we're going to be looking a lot about investments. In fact, there's one thing I didn't get a chance to mention, which is one of our second poll results, and this also leads to some potential for stories, I believe. The question was, how can we best prepare healthcare workers for future pandemics? And by far and away, the biggest response was by investing in health systems strengthening. And I think a lot of that, obviously, how do you do that? What goes about doing that? How do you move from promises on paper or promises at a big meeting to actually doing it? And how do you manage to do those investments while juggling all the other priorities when there's a lot of demands on a country? So these are the things I'll be asking you guys to look into.
I guess strengthening makes me think of resilience, which makes me think of spending money on problems which might not ever occur. And I sometimes wonder whether the 2020 experience will lead to a change so that we avoid the kind of things we've seen where, the pandemic task force meets and then is disbanded. Oh, we don't need to worry about that. And then here we are, I think it probably goes to something about what you think about humanity's ability to learn from its errors to think about how we might do things differently in the future. I was really interested to hear about the public-private dimension and just the courage of people who, there was obviously still is a need for healthcare workers and people to come in and do this work. It was already a daunting job. Imagine going knowing all that we know now about this this pandemic. The conversation kind of brought home to me the courage of healthcare.
Right, and the challenge of just having people listen to them, right? And it's hard. There's so many challenges, and also I think it brought home the whole need to make sure that healthcare workers at all levels of healthcare workers are protected, in order to bring about confidence in the setting, as well as to make sure that you're keeping your workers who need to help keep everyone else safe, you're keeping them safe as well. So a really interesting discussion.